Did you know that the prevalence of childhood obesity has more than tripled in the past 4 decades? But what factors are contributing to this alarming trend? Childhood obesity is a crisis that's been steadily escalating, capturing the attention of parents, educators, and health professionals alike. It's a complex issue born from a mix of genetics, environment, and behavior. Understanding this growing epidemic is crucial in turning the tide, and it begins with examining the root causes. Let's delve into the different factors that are contributing to the rise in childhood obesity. Firstly, we look at dietary habits and physical activity levels. The prevalence of energy-dense, nutrient-poor foods high in sugars, fats, and processed products is a key player in childhood obesity. Fast food, sugary beverages, and low-nutrient snacks are all too common. Pair this with a sedentary lifestyle of increased screen time and limited outdoor play, and we're setting the stage for obesity. The balance between what we consume and how active we are plays a significant role in our health. But it's not just about diet and activity levels. Genetics and family environments play a significant role too. Next, we explore how genetics and family environment influence childhood obesity. Genetic factors can predispose a child to obesity, creating an uphill battle from the start. Yet, the influence doesn't stop at DNA. Family habits, including eating patterns and levels of physical activity, play a substantial role. If a household leans towards unhealthy foods and a sedentary lifestyle, a child is more likely to adopt these behaviors. While these factors are significant, socioeconomic and psychological factors, as well as certain medical conditions and marketing practices also contribute. Let's now examine some of the other contributing factors. Socioeconomic aspects can limit access to nutritious food and safe play areas. Psychological elements like using food as a stress or boredom relief also play a role. Certain medical conditions or medications may contribute to weight gain. Lastly, exposure to advertisements promoting unhealthy foods can influence a child's food choices. Addressing childhood obesity requires a comprehensive, multifaceted approach involving parents, schools, communities, and healthcare providers. So, what have we learned about the factors contributing to childhood obesity? We've highlighted the role of dietary habits and physical activity levels, showing how energy-dense, nutrient-poor foods and a sedentary lifestyle can tip the balance. We've considered how genetics and family environment can influence a child's susceptibility to obesity, and how socioeconomic factors and psychological issues can exacerbate the problem. We've also touched on medical conditions and the impact of marketing and advertising on our children's eating habits. The types of obesity, from android to hyperplastic, and their associated health risks, were also discussed. Importantly, we've emphasized that childhood obesity is a complex issue that doesn't have a one-size-fits-all solution. Prevention and treatment require a comprehensive, multifaceted approach that involves everyone: parents, schools, communities, and healthcare providers. Childhood obesity is a complex issue that requires our collective effort to address. By understanding the contributing factors, we can work together to create a healthier future